Hey everyone, it's Dr. Erica Person from Flex Audiology, and today I want to give you an important update regarding an insurance change that's been causing some headaches for both patients and providers. Specifically, we're going to talk about the Humana Pathways Medicaid Program here in Indiana. And I want to be clear, I'm just going to talk about the Medicaid side. This doesn't pertain to their commercial plans in any way, shape, or form. But I'd like to cover what's supposed to happen, and then also cover what's been happening and kind of what I've heard through the grapevine. So if you get an opportunity and you like this content, please hit that subscribe button. That really helps us grow our channel. So in the past, we had providers like myself. We were directly connected with the Indiana Medicaid program, and it was actually pretty easy. So a patient would come in, we would test them, we'd send the results to their physician, the physician would send us back clearance, and then we would petition for approval with the patients directly to the Medicaid program. That approval took maybe about a week. It was sometimes 2 weeks. It's pretty quick. It was pretty streamlined. And then we would fit the patient, we would submit the claim, and we got paid usually within about 30 days. So really easy. I mean, there's definitely some pieces and some moving parts, but generally it was pretty streamlined. It was easy to navigate. And then last year, the Indiana Pathways for Aging came into play. And what happened is that I don't know how they did it, but they took all these medical assistance patients and they put some in Humana, some in Anthem, and some in United Healthcare. And I'll do a specific video about each of those separately. And from there, it really got confusing for providers because we didn't know if we were part of the Humana Medicaid, if we were grandfathered in, if we naturally were able to deal with Medicaid with them, if they were sending out contracts. I remember getting letters from them saying, if you're an Indiana Medicaid provider, you're going to automatically be able to be part of this program. And so it appeared that it was just going to be, okay, we're just going to move who you send the claim to, so that way we're not dealing with the state of Indiana directly. So that's how it's supposed to go. And when we would call in the beginning, when I would call Humana, specifically the Pathways Department, some of them would say, oh, well, the reason that you're getting denied all of this is that it's supposed to go through a third-party vendor called True Hearing. And True Hearing deals with all kinds of different plans, commercial, Medicaid, otherwise. But then we would put the patient in the True Hearing portal, and all of a sudden this Medicaid patient who has limited funds they were saying they were going to have to pay an exorbitant amount of money for these hearing aids. And so we'd call back to Humana and we would just go back and forth. And then they were like, oh no, you got to file it to True Hearing. Well, True Hearing is not an insurance company, they're a business. So there was really nothing to file. There's no way to file it to True Hearing to get it denied. And so it just didn't really make sense. And so then they kind of streamlined their process a little bit, saying, oh, and I say streamline, meaning here's more clear. This is where you need to send your prior approvals. And so then I would get approvals and then I would submit the approvals, but then they would come back and pay me $0. And so you heard that right, $0. And I would call and they'd say, yeah, we paid it out correctly. You just got paid nothing. And I said, well, that's great, but I don't like to work for free and I can't afford to work for free. We're going to go out of business if I agreed to work for nothing. So they were like, oh, no, you signed a contract that said you agreed to work for nothing. I said, okay, great. Can I get a copy of this contract? And long story short, no, we found the contract. I did not agree to work for $0, and they're paying out the claims. But now what they're doing is they are slowly just either denying, not paying. They're doing all the things to not let these things go through. So I have Flex Audiology. We will work with Humana, but we take it in steps at this point. So step one being is we will test you, but we will not do anything else until we get paid for that diagnostic testing. And I had one patient that it took 5 months for us to get paid for routine. And I say routine meaning he had hearing loss and he was diagnosed And I say routine, it's because it should have been a very easy claim, send it off, get it paid. But it took about 5 months for him to get that claim paid. And then we submitted for the prior auth. And when I called for the prior auth, the guy on the phone literally said, well, I can't do a prior auth. You have to submit it to Medicare and get it denied. And I'm like, okay, first of all, this is not how that works when it comes to Indiana Medicaid. So we had that discussion. So then he manually put it in, and I guess it got approved, but I never got notice that it got approved. The patient actually got a letter in the mail that said it was approved. So he called me and was like, I got it approved. And I said, great. I need to call him and I need to get a copy of that letter because my trust level is very, very small right now. So I just got off the phone with them, and the woman was very nice, and she's like, yeah, we'll get that right faxed over to you. And I said, I hope I get the fax, but if I don't, is there any way you can mail it through the post office? I'm like, I really would like to have a hard copy of this approval, because my guess is that even though it's got approved, it's probably going to be on the paid out incorrectly. So all of this to say is that we were continuing to take medical assistance. We're continuing to take Medicaid. We will work in this area, Dearborn County, Hamilton County, to work with you guys. And it's probably just going to have to be more of a partnership where you're involved in your insurance. And I will say that the time frame's coming up to switch insurances, and there are some in our state that are a little bit easier to work with than others. So take a look at some of my other videos. If you guys have any questions pertaining to your specific policy, check out our website. You can put your information in and we will check it out and get back to you as soon as we can. Caveat to that, we only check insurance that's local to our area, because insurance can change from county to county and state to state. So hope you guys have a great day. Thank you.